Okay, in this toolbox, the communication module toolbox number 4, we're looking at utilization of the open-ended questions and communications with the difficult caller. Our objectives in this module are to look at the benefits of using open-ended questions, examples of open-ended questions, telehealth communication factors, following up on an open-ended question. Now, the benefits of using open-ended questions in telehealth are very widely known. Asking an open-ended question is a nursing communication technique that allows the patient to explain what they're feeling. Open-ended questions allow the caller to voice what they're experiencing in detail in their own words. Open-ended questions make it easier for the triagers to focus their ask follow-up questions, right? What we're going to ask after. The information received from the patient helps the nurse to specify their advice for the caller. And when the caller is upset, the open-ended question allows the difficult caller to vent. So simply talk and talk and talk. This is something that you'll hear. Can you let me finish? Difficult callers a lot of time will feel they're not being heard because we want to go through our questions. Please tell me, where is your pain? Rate it 1 out of 10. When did it start? Does it radiate? We have to get these things known. We must get through our triage questions, our medical triage questions, to get to the appropriate disposition, to get them the appropriate advice. But when you're having a difficult caller, a lot of times you have to take a breath, take a step back. Yes, continue to lead the conversation, but use those open-ended questions so that they can say what they need to say, and then you can focus on what you need, what's left out, and what you need to focus on. I love this quote. Knowledge is knowing what to say. Wisdom is knowing whether or not to say it. Okay, so we're looking at examples of open-ended questions and how they apply to telephonic nursing. The why, the what's, the when's, the how, the who, the where, right? Always lead with an open-ended question. Open-ended question. How can I help you today? What are your concerns today? Consistency of care questions. I see you mentioned to the answering service you're having abdominal pain. Can you tell me about that? Is there anything else you need? Safety concerns. Do you feel safe? Is there anything you're worried about? Pain management. How is your pain level? Are you comfortable? Care plan. Do you understand what we've talked about? Pause. Always give a minute. Can you tell me about your surgery? Do you have any appointments coming up with your providers? Communication. Do you have any questions? Even if you've just told them you're not going to call in their narcotic, do you have any questions? Let them tell you what they want to say. Write it down, send it to the office. These are their concerns. Now, the uniqueness of the telephonic nurse, the telehealth communication factors are immense. You know, when you just tell somebody, I work from home, I'm a nurse, I do telephone triage and nursing. What? How do you do that? You just, how is that? How does that work? So with this, we're going to look at all the kind of scope of what's going on in that call. And there's so many little pieces of how the patient will respond, how the nurse is going to respond. First of all, environmental factors. Is it night shift, time of day, presence of others, background noise, state they're calling from? Is it 3 o'clock in the morning, there's a screaming baby and a husband who's yelling in the background? Are they on the side of the road? Are they homeless? Are they suicidal, but they're with a family member? Or maybe a whole bunch of college friends? Interpersonal perceptions. How the callers and the nurses perceive each other and assume how and what they think. Now, a lot of times we'll assume, based on the chart we're given, based upon the chief complaint, how the call's going to go. Lots of times we're very wrong. They may assume what we're going to do or say is very different than what we are going to do or say. The ability to relate to others. Cautious, shy, outgoing, confrontational. How is the caller? Are they cautious? Are they not telling you everything? Are they outgoing? Are they manic? Are they talk like I am right now? Knowledge, nursing knowledge and patient self-actualization. Again, that's going back to the EI, but knowledge and understanding of their prescriptions. Do you understand what prescriptions are telling you, what they take for the diabetes, why the blood sugar is so high, why is it so low, and health, the general state of the health, the general state of the healthcare. Do you have access to their old charts or do you not? Equipment. Now, this is IT access to medical records, client group protocols, and past calls from the patient. Is that accessible to you? It's going to factor into how the call is going to go. Attitude, open-minded versus closed-minded, caring versus judgmental, prejudice. Is it a translator call? Is it taking you a really long time to get a Mandarin translator? And now you're irritated. Of course, we can't be with the telephone triage nurse. Are they irritated? Is it someone who speaks Spanish and a little bit of English but insists upon a translator and it's taking a very long time to get one? Or perhaps the translator isn't telling you everything you feel you want to know. Socio-cultural factors, ethnicity, affluence, poverty, religion, these things work into the call. Is the husband calling for the wife even though she's in the room? You can't talk to her. Past experiences, positive or negative experiences with the office or the telephone triage nurse. This is absolutely going to lead into how they're going to treat you. Do they love the doctor? Do they love the nurses there? Or are they completely irritated and fed up with them? How long they wait for a callback. Especially through COVID, there have been very, very long callbacks times. 3 hours, perhaps 6 hours, an hour to wait for the nurse. Or is it their perception that they waited a long time and it's really only been 10 minutes? So how long did they have to wait? What is their perception of their wait time to talk to the nurse, to finally get you? Okay, now, right. It's very easy to ask that open-ended question. How are you doing today? But what do you say when you've heard all they have to say? How do you follow up on that? So the therapeutic strategy, this is right out of nursing 101, maybe not nursing 101, but everything we learned back in nursing school, but just applying it to telephone triage. So sharing observations, the nurse shares his or her observation or perceptions with the client or patient. So I notice you're speaking very quickly, right? General leads, encouraging the patient to continue speaking. I hear you. Please go on. Okay. A lot of time if they're going on and on, they say, are you there? Are you listening? Do you hear me? Yes. So if you're interjecting those littles, okay. Oh, I see. Identifying themes. The nurse shares consistent topics or issues that arise in the client's conversation. I notice that you're very concerned about your daughter's fever. Focusing. Ask the client to elaborate on a specific topic. Can you tell me more about your trouble sleeping? Is it just today or is it something you've always been dealing with? Voicing doubt. Expressing gentle disbelief to avoid reinforcing the client's misperception. So basically the client or the patient tells the nurse that their daughter doesn't care about her feelings. The nurse responds, really? Presenting reality. The nurse presents his or her view of the reality. I know you think the staff is trying to poison you, but I do not believe that's true. So in summary, beginning a call with an open-ended question shows respect for the patient concerns, not a timeline you're trying to get through to get to the end, to get to the next call, to go to your lunch break, to go to the bathroom. Being on a call, beginning the call with patience and kindness and empathy and asking, how can I help you today? Follow-up questions demonstrates the patient was heard and the nurse is seeking to understand and hopes to address the patient concerns. And then actively listening to the patient and responding with encouragement demonstrates the nurse hears and cares for the caller.